Hi, so the reason why I have my mask on is because, we're dealing with the COVID-19 lockdown and we still have school, so I have my mask on, but you don't have to have your mask on when you're doing the skill, okay? All right, so taking it from the top. Hello, Miss Tracy, good morning. My name is Amy and I'm your nursing assistant today. I'm gonna be doing adult brief, but before I do anything, I'm just gonna wash my hands and pull the privacy curtain for your privacy. I'll be right back. Let me go get my supplies. So I'm getting my supplies. One thing you're gonna notice is I go for cookie points. So I'm gonna have my barrier, the waterproof, and my towel. So towel goes down. I'm gonna arrange things the way I need them, okay? So I know that this goes first. This is gonna be the last thing I'm gonna be doing. And then we have this, we have this, we have that. And you're gonna see why I'm doing it the way I'm doing it, okay? So now that I'm back, big thing, I'm gonna choose a side. So just so you guys can see me properly, I'm gonna choose that side and then have the side roll up. Using proper body mechanics, always make sure you cannot bend at your waist. You should always stoop or squat. So this is the side I'm gonna be working on. How you doing, ma'am? Cookie points, things to say to impress them, My patient is centered and aligned. My patient doesn't have pain. Do you have pain, ma'am? She says no, she denies pain. She's comfortable. So now I'm gonna take the bed up. Okay, I'm taking the bed up to a working level for me, and that's usually thigh high or waist high, okay? So now I look at the table, always look at the table. The table will tell you what your next step will be. My next step is the privacy blanket or the privacy towel in this case. So careful not to shake or fluff. I'm going to carefully unfold this on her. And again, I teach you guys the technique to pass. Once you have a clothing, okay, I'm gonna pull this down a little bit so you can hear what I'm saying. You're all 6 feet, we're maintaining 6 feet social distancing. None of the students are close to me. So when you have a clothing or a linen on top of another one, the proper technique is to fan fold the one underneath it. So that's what we're doing right now. Again, privacy is very important, so that's what I'm doing. We're going to maintain privacy. Then I'm looking at my table and I see gloves. And then underneath the gloves, I see the waterproof padding. So that tells me that I need to put my gloves on because now I'm about to work on my patient. I'm about to touch the waterproof or incontinent pad. So what I'm gonna do is, I'm gonna grab my gloves. I'm gonna have my patient turn. Now for skills like this, because we're gonna be doing the peri area, so it's gonna be a mannequin, okay? It's not gonna be a human, but you still talk to them with respect. You still show them dignity and they need to be covered at all times. So privacy is also important. So I'm gonna have her turn now. If you can, ma'am, I need you to grab the side rail. So she's gonna turn for me. Now she's turning, cookie points, okay? Things to say, because you want to cover your bases. She's not lying on the side arm. I'm supporting her head as she's turning and her airway is not obstructed. Are you okay, ma'am? She says yes. Again, patient remains covered at all times. So I have room now to work. So I get my waterproof, okay? and I place it, again, I'm eyeballing, just making sure I have enough on both sides. So I'm gonna have her come lie on her side. Lie back on her back. Okay, again, supporting the head, making sure patient is comfortable. I reach over, I flop out the other side. So what I'm gonna do now is I'm gonna roll the privacy towel and expose only the part I'm working with. I look at the table, it matches. So I have an adult brief, an adult brief. They're not called diapers because they're not babies, so please do not call them diapers, okay? Are you able to see me, or you can come closer?
I can.
Okay. So we're still maintaining social distancing, but I need you to get this, my mask on. So now what I'm gonna do is I'm going to take off the adult brief. Now there are bold points that you need to be mindful of, and you've got to say them. If you don't say them, then you can't get credit for it. You will fail the skill. So the bold point, this is how I teach it. I roll this down this way, and at this time I am going to state, patient will be washed, rinsed, and dried. Okay, so that just takes care of that. I verbalize it. I don't necessarily have to get a basin, water, and actually do perineal care. I'm just gonna state that patient will be washed, rinsed, and dried, okay? So after saying that, I'm going to roll all this. So I'm gonna have her roll back on her side because I need to take this off, okay? If you don't mind, ma'am, could you please roll again? I just need to get rid of the soiled briefs. Again, she's not laying on her side. I'm supporting her head. She can breathe. Are you okay, ma'am? Are you laying on your side? She says no. So I take everything. See that? Everything I have. This is all going to the trash. So now, I should have, you can also have your trash and your linen basket closer to you if it's okay for you to move it. If not, some are just stationed where they are, and then that's what you're gonna do, okay? Now again, I have like a place to work. I look at my table, what I need is the adult brief. Remember, I gotta change, and that's why I'm changing her. So we're gonna eyeball this. You want to have enough towards the front and the back, okay? I'm gonna have her come back. You okay, ma'am? She says she's okay. Okay. Make sure it's out on the other side. And now, I'm gonna put the brief on her. And we're done with the skill. So what I'm gonna do, say here, is patient will be checked every 2 hours. Okay? So we're done with the skill. The proper technique will be, and that's what I'm doing here. Go ahead. To get rid of this, remember, put this on top of this so you can get this off. Remember, when you have a linen on top of another linen, or clothing on top of another clothing, the one underneath comes off, just like you did when you're taking this down. Again. This goes. Just get rid of all my linen at the same time. So my table is empty and I'm good. So I'm done with the skill. The next thing I need to do is take the bed down. And while I'm doing that, I'm asking her, do you need your head raised? She's like, yeah, okay. So raise the bed. Raise the head of the bed. The next thing now, I have to go over to the other side. I have to unrestrain her. Using proper body mechanics. I'm gonna give her a call line. Here you go, ma'am. So call line is within reach. Patient maintains good body alignment. Head supported, okay. Do you have pain, ma'am? She says no, she doesn't have pain. I'm gonna push this back right now because I'm ready to end my skill. Bed is low, patient is comfortable, patient is covered, offered her covers. Call line within reach, so I'm gonna take off my gloves. Again, you have to be careful. That's something they're gonna watch. And watch you take off your gloves. Remember, clean to clean, soil to soil. Be careful with these other fingers, so they're not touching that when you just turn it. Okay? This goes in the trash. Wash your hands and I'm done.